Hello and welcome to the Clinical Care Options Infectious Disease Podcast. I'm your host, Sarah Anderson. Today's episode is part of an ongoing series of addressing misunderstandings in applying HBV treatment guidelines. This series features brief conversations between a physician and a patient in which they discuss ways to collaborate in care and reach shared decisions, often describing their own experiences. In this episode, Dr. Christina L, Associate Professor in the Division of Digestive Diseases and Nutrition at the University of Kentucky, has a conversation with patient Rhonda on the HBV gray zone, what to do when the decision to start treatment is not clear because of borderline ALT results and HBV DNA levels. For more information about Dr. Dela and Rhonda, and for a link to additional online education on this topic and more, please visit the link in the show notes. So, Rhonda and Dr. Dela, thank you so much for joining me today. I'm going to turn it over to Rhonda to describe her hepatitis B diagnosis and what that was like.
I was diagnosed about 32 years ago with hepatitis B. I was told at that time that I was only a carrier, that after numerous tests that my OBGYN done, he said that my numbers was very low, and that pretty much all that he told me was that I was a carrier, that if I went to a doctor that I needed to make them aware of it. If I was to get cut or anything of that nature, then I needed to be very careful around people, especially that people maybe like with cancer or had their immune system was very low, that I could possibly transfer it to them. If I had any more children, I had to take and get the 3 shots for my children, any children that I had, to protect them from it. He didn't really go into detail to me of what it was or how it affected my body or anything. He just kind of just told me that's what it was, and that wasn't a treatment because my numbers wasn't high enough. And so he just told me to keep an eye on it every year, have it checked, and if my numbers went above a level, then we would have to go from there. So that's kind of what I've done over the years. Is I would have to find different doctors to have my levels checked, which none would tell me what my levels were, what the normal levels were, where I needed to be, or anything like that. They just would check them, and I would assume that they were okay because they never contacted me back about any treatment or anything of that nature until about 4 years ago. I got sick and was diagnosed with cancer, and then I had to have some surgery, and then in those surgeries there was some tumors that was discovered in my liver. And after the cancer was taken care of, that is when we started taking care of the liver, and that is when I had the pleasure of meeting Dr. Dela. When I met her, that's when she started running numerous tests on me. She found out that I had I had a surgery that removed the largest tumor, which they at first thought was cancerous, but it wasn't. And then they had sent me to her, referred me to her, and she ran tests on me to find out, everything that was going on. And I went in and done all that. And that's when I found out that there were some other little things going on. And we sat down, we discussed it, and we came up with a treatment plan, which I've been following. I lost some weight, and we started on the medicine. And so far, I've been doing really great on it, and everything's been going really great since. So we're going to continue on that path.
All right. Rhonda, that was such an excellent summary and evidence that you're very well informed and understand your condition. So when I saw her for the first time in 2019, she was actually referred to me mainly for the NASH, non-alcoholic steatohepatitis, noted on the biopsy of the liver mass. The liver mass was found to be benign, called focal nodular hyperplasia, but there was a component of the NASH, non-alcoholic steatohepatitis, in that biopsy. That's why she was referred to me. At that time, her hepatitis B status, she mentioned that she was a carrier. However, her liver enzymes and DNA was borderline or in the gray zone. Carrier usually is associated with a viral load of less than 2,000. It had ranged like less than 2,000, but when I saw her DNA went up to 2,600. And in terms of her liver enzymes, it was 36 to 40 when I saw her. However, a couple of months prior, it had been up to 50s to 80s. It's hard to assess if this elevation of the liver enzymes is related to her fatty liver or not. Thus, I obtained a test which is not routinely done, but we do it in certain cases where the liver enzymes or hepatitis B is in the gray zone. Not all carriers are treated. Thus, I obtained a test called quantitative surface antigen. This is a test that if it's greater than 1,000, this indicates that she may not be a carrier and is associated with cirrhosis, or is also associated with an increased risk for liver cancer if it's more than 1,000. So her quantitative surface antigen was 20,000. Thus, I started treatment on her because this suggests that she may not be a carrier now, and she may be at risk for liver disease. Thus, I started her on tenofovir alafenamide. Then, also for her NASH, she was also started on vitamin E. She has done such a great job. Her body mass index was 39.9 in 2019, and over the last year, it went down to 37 with dietary modification and exercise. Also, the family history was also considered. She does have family history of hepatitis B in her mother and her brother, indicating that she may have been a carrier for several years. There's no family history of HCC or liver cancer, but there was a mention that her maternal grandmother may have had hepatitis B related complications. So I started her on TAF initially. She was around 50 at that time, and I know that she will be on this treatment for some time. So if she goes into the postmenopausal stage, she may be at risk for osteopenia or osteoporosis. Thus, I chose TAF over TDF. And also, one other possibility is can also be entecavir, but it was approved. The TAF was approved by your insurance, so those are two potential options. But TDF could also be given. Another thing that happened is into a year after we started treatment, her insurance changed their coverage from tenofovir alafenamide to TDF, so she was switched to tenofovir disoproxil fumarate. Because that was the coverage was changed, I decided to do a DEXA scan just to check, for any osteopenia or osteoporosis. But it was normal, so thus I continued her TDF.
I tolerate both of the medicines extremely well. I've not noticed any side effects from either of them. I seem to be doing pretty much the same on both of them. I was never notified that my insurance had changed. They just quit paying for it. So we had to kind of come up with another plan, which, is working out as of right now. But we also have another plan in place. If it doesn't work out, we have another route that we're going to go. So, we've got plans that we're going to take care of this, and we're going to fix this liver.
Yeah. And right now, in terms of her liver enzymes continue to be normal. Her hepatitis B DNA continue to be not detected, of course, on treatment. And then she, as I've mentioned, she has done very well in terms of her weight loss, significant improvement in her weight with her dietary modification and exercise. She's lost probably 26 pounds over the last year. Her body mass index has decreased from 39.9 to 37, which is really good.
Thank you for sharing all that you have, Rhonda. Is there anything that you think doctors should know about patients with hepatitis B and shared decision making?
The only thing that I would recommend is to actually talk to them and, know that they understand what they're talking, because a lot of people will get up and leave the doctor's office not knowing exactly what their diagnosis was, not knowing what their treatment is. They may know that they're going to take medicine, but they may not, understand why they're taking the medicine or anything of that nature. And, my recommendation would be, to make sure they understand if it is hepatitis B, what hepatitis B is, how it's going to affect their bodies, how it's going to affect their families, because it does affect your whole family. So, and that would be the one thing that if I could have something taken away from this, that's what it would be, is the knowledge of it. Because that's what I didn't have when I found out 32 years ago. Of course, at that time, there probably wasn't as much knowledge about it as they are today. But, when they told me what it was, I had no clue. I didn't have internet to look it up, and I didn't have cell phones to Google it or anything. And so I didn't have a clue. I just knew that I had it and that I could possibly give it to somebody else. So, and that's a scary thought in itself. If they're going to be okay, let them know they're going to be okay. And then, that there is treatment, that we can, work together, come up with a plan, and, everything can be okay as best that it can. Not always is that the answer, but, sometimes it just helps that your doctor will go that extra mile and is not always just trying to rush and hurry up and get back out of your room with you.
Sometimes hepatitis B is not straightforward. There are patients in the gray zone. And as with Rhonda's case, there are also other conditions, particularly the NASH or non-alcoholic fatty liver disease, that can make the clinical picture not straightforward. So that's why I do take time to explain to them. And then after explaining, I can also have them reiterate what they understand and ask them more if there's any other questions I can give them. And sometimes, the first visit might be a little bit overwhelming, so we kind of repeat another education maybe on the next visit. So I make myself available if they have questions after the initial visit.
Thank you, Rhonda and Dr. Dela Cruz, for sharing that conversation with us. I really appreciate your time today. And thanks to our listeners for joining us. As a reminder, if you would like to hear short presentations on additional topics related to care of hepatitis B, I invite you to visit the Clinical Care Options website by clicking on the link in the show notes. And please be sure to check back regularly for more episodes on important infectious disease topics. Thank you.